I'm really excited about this panel. There's definitely a lot of firepower on the stage with R1, Cerner, and Cognizant. I think each of these guys are worthy of a keynote unto themselves. So what we're going to do today is we're just going to work our way down the line, and we're going to hear from Jim first. And each of these guys have products and use cases they're pursuing, so I'm going to give them each a few minutes to talk about that. So, Jim.
Yeah, good morning. I think I attended this conference last year and left with thoughts of how Cerner could work within the current existing protocols within healthcare. We heard a lot of kind of new thoughts related to very disruptive technology with blockchain. And so what we've done, we're investing heavily in interoperability, and we have several use cases that are really for the payer community. And we've taken a variant of that and made a blockchain use case out of that. So what we're doing is we are providing linkage within the financial medical claim back to the clinical data associated with that claim. So as a blockchain initiative, we're using Hyperledger Fabric. And what we're doing is we're taking elements out of the claim. We are taking provider ID, payer ID, patient ID, and we're interacting with the chain and generating a hash key. And we're putting that hash key in the blockchain. And then what we're inserting into the blockchain is a FHIR resource, a URL. And so if you're a participating payer, you'll have access using that hash key to unlock the FHIR URL to directly access the data associated with that financial claim. And we have other use cases where we could use that same key, and if you're a participant in the network, we would go use HL7 protocol, pick up a number of CCDAs, and then leverage an X12 claim attachment to actually send you that data. The use case supports a number of different challenges from the payer side, where if they have a claim, they need more clinical data in order to pay, as well as if they're administering in a Medicaid Advantage program, they need additional data for quality metrics and HEDIS measures for that. So that is our kind of entry into blockchain. It's a POC at the moment. We believe that Cerner needs to provide, we really need to be the conduit of the network. So I have a couple platoons of teams, software engineers that are building FHIR-like APIs to enable that, involved with DaVinci, a number of other projects, and have the belief that we just need to enable any avenue that's available to get better access to that data.
And so, Jim, do you want to talk about the process you went through to settle on that use case?
Yeah, I think from a process standpoint, we've resonated really on the financial side for various reasons. I have a background in the finance industry and followed Bitcoin for quite a while. And as we iterated through various examples, this just became one where there's not a true linkage today. We really we're kind of a clearinghouse plus entity within Cerner. I think there's a lot of advantages to that that we can impact to reduce the administrative cost of healthcare. And there wasn't this type of linkage. It doesn't exist today. We're building that through this process, plus some other products to kind of play in that space.
And then in moving forward, what are your next objectives for that project?
Well, first we want to make it demonstrable, so I think in the next month or so we'll have that. And then we're already in conversation with several payers for different avenues. So we've had a lot of the payer community come to us asking for access to our population health data. And, you know, it's kind of fake news that Cerner owns this data. You know, we were building access to that. I don't think I've been called an oligarch at this conference yet. But you know, we're very open to opening that up. And so it varies from, we'll just forget about all the protocols, just give us a data dump, to we'll take anything you have, structured, unstructured, fire, to make it work. So I'm trying to marry a financial process and pull the clinical data in associated with that, with what we're trying to do. So.
That's great. And so I'm going to move over to Fletcher now. So Fletcher's with Cognizant. And Fletcher, I want you to kind of talk a little bit about first the scale of Cognizant, the companies underneath that, and then I know you've done a project overseas, and we're excited to hear about that.
Yeah, absolutely. So as Philip mentioned, my name's Fletcher. I'm with Cognizant. You know, Cognizant, if you're not familiar with us, we're a professional services firm helping our large enterprise clients across industry, but specifically in healthcare with payer providers, pharma manufacturers, really transition to digital. Cognizant also has a fully owned subsidiary with Roseto, right, which is one of the leading technology companies, particularly around the claim often in the industry. And I think through Cognizant's software products, through Roseto and others, I think about 50% of claims are processed through our systems in the United States. So we have a big footprint. You know, when we think about the revenue cycle, right, that's a big kind of broad kind of category. But we do think it is right for disruption and transformation with blockchain for a few reasons. And when I talk about that, I'm actually more focused on the front end and back end, right? The mid-cycle, which is more of a coding as an internal process that isn't really as, the blockchain won't touch as much. But first of all, there's just an inherent lack of trust in this industry, as we've heard throughout the conference. I used to actually work in helping create software for providers to just estimate what the payer should be paying them, right? So they can calculate under and over payments from claims, because the adjudication is a little bit of a black box for them, and so they're just trying to mimic what they think is supposed to happen so they can compare it, right? Like they're spending lots of money on technology systems like that, and right, because there's a trust in how that process runs. And there's other examples as well that I could mention. The second is about the reason it's ripe for transformation is just the amount of information that is shared, right? We have a lot through EDI transactions, but we have eligibility, authorization, right? When there's denials, we have appeals, we have claim status inquiries, we have medical and clinical data that needs to be submitted and appealed to those to the denials, right? There's a lot of information sharing. And while EDI transactions, right, are a good way to make kind of point-to-point communications, it's mostly kind of an ask and receive type model, whereas blockchain can make that a more like a holistically transparent in a lot of different ways. And then the third reason why we see it ripe is just the transition to value-based care models, right, and the increased complexity that is presenting both in how things are adjudicated, so that trust factor I talked about is becoming more of an issue, and just the amount of data that needs to be shared because of the outcomes-driven approach. So we see this as really a transformative area, and there's a lot of vision out there about the claim processing really being holistically transformed, but if you look at a provider perspective, right, cost to collect is such a key metric that they are managed around, So they can only make incremental investments in IT systems. So we feel that this is going to be more of a piecemeal type approach as opposed to a rip and replace. And you're going to see point solutions around eligibility or prior auth, right? You know, a great example could just be payers coming together to share, right, which kind of services are required that require prior authorization for providers to be able to access in a decentralized manner. And so a lot of different kind of point solutions we see. But all of that will be building towards, right, ultimately, over time, like a straight-through processing of the claim. And we have a great case study that you mentioned, that you kind of referenced. It's actually in Singapore, right, because the jurisdictional, the regulatory environment was a little bit more friendly to start there. That really gets to how this kind of vision of straight-through processing of a claim could be feasible. So if you're not familiar with Singapore's healthcare system, it's a single payer. They have quite a few coverage gaps based on your income level. You get different amounts of kind of reimbursement and subsidies for your health care, and one of those happens to be gestational diabetes. And unfortunately, Singapore has a outsized proportion of that disease. I think it's 1 in 5 women in Singapore suffer, whereas in the United States, I think it's like 1 in 20, something of that nature. And there's a coverage gap. So we actually convened a consortia with MetLife Singapore as the insurance provider, an EMR vendor called Vault Dragon, and that's local to that jurisdiction, and the Monetary Authority of Singapore all together. And we created a use case that's actually live in production. A lot of what we talked about today, a lot of what we heard is still proof of concepts and pilots, and blockchain's not quite there yet, but in healthcare, Cognizant has delivered an application that's being used and consumers are downloading and to access this care gap. And the benefit of blockchain here is, right, you're able to have automatic underwriting, and automatic claim adjudication around gestational diabetes, and you don't have any any storing of PHI on any of the parties that shouldn't. So the insurance company has no stored PHI as part of this process, right? You might imagine, hey, well, I could do straight-through processing of a claim with a central entity. The insurance company could provide that as a service, but then they'd have to hold and maintain that PHI. Here with blockchain, we're able to actually just kind of connect the dots. So it's a in-production use case, and we were able to translate. So I'm part of our blockchain distributed ledger practice, which is a cross-industry group. We've been able to take our learnings from financial services and P&C insurance and really translate that to really accelerate the learning curve, right, in healthcare, as the adoption has lagged a bit. And we have multiple live in production case studies from those adjacent industries that we're able to get to market really quick in this example, because we're able to translate those learnings. So a little bit about what we've done and what we're kind of continuing to focus on. That application is, if you're in that jurisdiction, you can download on the App Store, sign up, and we're actually about to launch a new version of that in China as well. So we're seeing pickup as well. So real use cases of the technology are in existence. It just takes a little bit of the expertise to know how to get it from proof of concept stage and navigate to what it means to be live with such a nascent technology.
Awesome. And then within healthcare, your healthcare vertical, you guys are launching a blockchain center of excellence, or you have launched a blockchain center of excellence, and you also kind of sit in a unique place in the claims processing space. You want to talk to that a little bit?
Yeah, so we translate kind of our learnings and the different stakeholder groups within Cognizant from Roseto, our traditional kind of Cognizant consulting, and as well as our blockchain expertise. And also because the cloud providers here are also pretty important and influential in the space. There's expertise there, right? All coming together to form kind of a center of excellence for our clients to really be able to accelerate this around some key use cases. And really with the Roseto kind of product suite and kind of network, right, there's some really interesting kind of innovative things that we are looking to do, and I think we'll have some announcements in the coming months that will be rather kind of exciting, that we're really hoping to be and have a position to be not only a partner, but also to in your efforts, but also help catalyze a lot of this, right? The biggest problem, or one of the biggest challenges And getting a project to production is getting the network in place, right? And a lot of times it's a very thin proposition, right? There's not many other people who have the capabilities in your ecosystem that have the capabilities on blockchain and are focused on the same use case as you and are at the same level of complexity and maturity to be able to make that happen. And so you need some visibility as to what's going on to help navigate that. And that's kind of a role that we see ourselves playing in this space.
That's great. And I'm going to move on to David now. David Millen with R1. David, I would love for you just to take like 2 or 3 minutes and talk about your background. And I really feel like you're on an exciting journey with the merger of Intermedics and R1. So I'd love to hear about your background, talk about those companies and what you see for the future.
Yeah, okay, great. Thanks, Phil. So, first of all, let me just say this is my first time at this event, and in the last day and a half, it's been great. There's been some really good conversation, and I think the speakers and the audience has been totally engaged in that whole notion of how to apply blockchain to what is going on in the whole healthcare space. And so it's been a good day and a half for me, and certainly lots of things to share with the company when I get back. But part of the journey that you mentioned is I came to Nashville about 2.5 years or so ago to join a small company that was focused on RCM. That company was Intermedics. It was a full-service RCM company, and prior to that, I was working in some large firms, notably IBM and some other software vendors before that. And as part of that, I came here to sort of rebuild or refactor their RCM tooling to the extent that it could, reimagine a more productive and sort of efficient rev cycle capability. Earlier this year, we were acquired by a company out of Chicago named R1 RCM, and that's what I'm doing today. And it's been a great experience because while there were lots of synergies between R1 and Intermedics, the journey has recently picked up in, I think, a number of different cases and aspects. Most notably, and for those that aren't familiar with R1, let me just tell you that we're an end-to-end revenue cycle management company that partners with providers to make sure that both the financial scale and rev cycle outcomes are realized, but also we're obsessively focused on what we think of as the patient experience, which makes us a little bit different than many of the other RCM firms out there, primarily because, as we know, if a provider does exactly what they need to do and the service goes off without a hitch, but if the patient, during the process of understanding their bill, their responsibilities in that bill, and their payment of that bill, has a, negative experience, that entire outcome is reduced to something less than meaningful. And so as we partner with our providers and obsess about the patient experience, it is important to know that, we're a technology forward or an innovation company is the way I see it. And part of that journey has been to push the envelope on the healthcare space to the extent that we're trying to, what I would say, digitize the realm of the rev cycle. And that's everything from the front end, from when a patient experience takes place, to the financial clearance associated with that, to realizing their benefits, all the way through the middle part that Fletcher mentioned around coding, and certainly the end experience associated with processing that claim and billing it. But when I say digitizing it, what that means is reducing paper, reducing some of the manual interventions, et cetera. So what blockchain means to us from that concept, and just a perspective, it's an automation lever. It's an automation lever that drives the digitizing of that entire ecosystem. And when I say that, I'm talking about working with providers, with payers, and with patients. And the less paper involved, the more direct electronic integrations and interoperabilities that you can achieve, the better the experience for everybody, right? So, one of the things we do is we provide kiosks that allow patients to check in the middle of their scheduled experience to, pick up some demographics and elements that allow them to sort of then pass that information to the provider, so the provider has a little bit of background just in time to sort of service that need. And so as we do this, we view blockchain as an opportunity for us to move to the next level in both automation, but digitizing that entire experience. And so some of the things that we've been looking at have to do with, well, authorization management. So when you think of your experience as a patient and entering a physician's facility to, get care, one of the things you do is you allow them to sort of get access to your information. You share that, and it has everything from details about your coverage to, your personal information. Being able to interact with payers in that network in a digital form, instead of having a provider do it manually or keyed into one system and swivel chair it to another system, is a very big deal. And so to be able to do that in the context of what much of this conference has been speaking about too, well, smart contracts is another opportunity to sort of elevate that. So imagine that there is an authorization opportunity where your specific coverage model is known and the payer responds to that across a blockchain event that can allow you to then sort of clear the actual transaction in a way that's known to both the patient and the payer at that moment, to the extent that a patient experiences, oh, I know exactly what my coverage is. I know exactly what my obligations are. So that's just one example of where we're focused on trying to digitize that entire experience. One of our recent efforts has been to try to better understand this notion of smart contracting, and I've been doing a fair amount of research, and some of this is my own personal perspective and not necessarily that of R1, but I hope to make it part of R1. But, and that's this notion of smart contracting, where one of the functions we have in our end-to-end rev cycle is about onboarding physicians across a slew of facilities. And so when you're dealing with large hospital networks in the country, and you're trying to enable physicians to participate and provide services at multiple locations, what you don't want to do is have to do that same work multiple times. And what you don't want to do is engage in one of those highly, costly sort of background, gather the information, put the data together, sign it and send it to one facility, send it to the next facility. So to be able to look at that credentialing use case and that onboarding use case alongside the smart contract function is just one other example of these, what I consider these digitized processes that make up the end-to-end rev cycle. And so to try to put maybe a little bit of a finer point on that, our potential and our opportunity is to take what today is a set of relationships across the provider, the payer, and the patient spectrum, and reimagine that. Reimagine that in the context of these electronic sort of contracting and negotiations and transactions that the underlying fabric of blockchain provides. And so I think there was a fair amount of conversation earlier about getting that agreement, right? It's not about just the trust, it's about the agreement, right? And so, one of the things that the healthcare industry does not excel at, and I don't think this is a surprise to anybody in the room, is we don't excel at interoperability. We don't excel at integrations. But when you can achieve that, and you can do things like leverage the blockchain to enable that, it's a big point of progress. So for everybody that's part of that more consumable healthcare experience that we're trying to reimagine. And remember, the patient is the consumer here. That patient has the same expectations of consuming their health care that you have in every other consumer experience that you think of today, like buying a product on Amazon, right? Or going to your local store and acquiring something. It's making sure that we aspire to commit to that same experience that patients have, and that's a big sort of weight to sort of pull forward. But so that's the focus. That's how we are viewing some of these advanced technologies. They're in service of digitizing that relationship. They're about automating and fulfilling the experience to so it's a simpler story, a simpler experience on behalf of providers and patients ultimately. And what I would say is that part of our perspective, my perspective on blockchain, is the whole distributed ledger capability that we've been talking about over the course of a day and a half is really an important enabler to be able to do that, because it enables the decentralizing of those capabilities in what I would call a safe and secure form. And that is the first part, or first step in being able to sort of step into an electronic contract with somebody. And being able to sort of create those networks within the network, because that's likely what it's going to come down to. It's not going to be much to maybe nobody's surprised. It's not going to be one large network that we all participate in. It's going to be a collection of networks that facilitate your business rules, your business engagements on your agreed upon terms, right? And those are smaller networks that can be connected, but fulfilling that part of it is, I think, a first and important step in all of that.
If I can jump into, yeah. I think a key point, especially with RCM, right, is when we're thinking about a lot of use cases in the healthcare space, right, the concept of the network that needs to be there, right? We just saw some pharmaceutical supply chain, right? There was 14 entities in that ecosystem trying to build this out, right? We're talking about medical interoperability and things like that. That's a lot of stakeholders and a lot of kind of incumbency to manage. Within the revenue cycle, we have kind of a more defined ecosystem, right? There's the provider, there's the payer, right? There's maybe the clearinghouse kind of services in the middle, right? Obviously, the patient is a critical stakeholder there, right? So when you're trying to coalesce the group to move forward to kind of a new distributed kind of architecture, right? It makes it a little bit more kind of manageable, right? Honestly, governance is hard, right? That's a really hard thing to do, and the more stakeholders you have involved, the harder governance becomes. And so that's a lot of the RCM type applications we're looking at have that kind of limited scope potential. So it's another reason why. Right? So when you think about these networks that are forming, right, and hopefully we'll see the kind of connect to the bigger picture too.
Yeah, I would absolutely agree with that, Fletcher. I mean, I think that there's a notion that the rev cycle, it's constrained to a large extent. And also the terms in which you interact in that ecosystem, they're fairly well known. And while we may not agree that the business rules in a payer's environment are exactly lined up with the business rules in a provider environment, there are certainly a subset of those business rules that they can agree on that would enable an electronic contract and an electronic sort of agreement to understand, and that is better for everyone.
So Jim, I want to kick it back to you here real quick, and I know we were talking earlier about Cerners, such a massive company. You're within the clearinghouse. How did you go about, getting the buy-in for your use case and getting that momentum internally? Because that is a daunting task, and there's a lot of people here who are at a large company who are going through that, and I'd love to hear any advice you have for them.
In the rev cycle space, Cerner has made significant investment over the past 5 years through acquisition and others. And I'm fortunate to be a part of a group that has done a lot of replatforming and been successful at it. So to be quite honest, at the moment, I'm internally funding this. And we are in the midst of building a demonstrable example that we can talk to, and then talk to some of the other partners. What I think is unique about where some of this could go, Cerner has a number of clients that have their own insurance companies, and we are very fortunate to serve the veterans community in the DoD, and I think there are a number of opportunities to reduce the administrative cost in the rev cycle, the financial side, when you have that in your ecosystem. And so we're constantly, I'm spending my thinking time for some of those fairly complex processes that shouldn't be there to gain efficiencies across that. And if blockchain can play a part in that, which I think it can, we'll leverage that. But I'm continuing. I debate with our distinguished engineers on the value of blockchain, right? It's just a distributed database. Why do you guys need to use it? And I was telling some panel beforehand, I think blockchain has given us an avenue to bring stakeholders together to communicate and to talk and solve problems in a different way based on this technology. And so I think that's where some of the opportunity lies for us at CERN.
Awesome. So we got about 5 minutes here, and I want to give each of you guys really, 2 minutes to kind of talk about what do you think your biggest barriers in 2019, and where do you think the blockchain and revenue cycle space will be at the end of next year? I'll start here with you, David.
Okay, great. So 2019, I would say if I were to put some aspirational things out there, I would say that in 2019, from a industry standpoint, we have smart contracts being consumed across multiple payer, provider, and patient environments, specifically the provider and patients. And I would say that blockchain is no longer questioned as what it is, but when are you going to start using it? And I think that the focus for it should be to enable sort of the electronic sharing of information to the extent that you can automate some of what today would be these rigid, manual, paper, and outdated interactions that you have. And I think there's a lot of common ground in that, and I think blockchain is the fabric that enables all that.
Fletcher.
Yeah, I think the only really way to like make a projection like that is to look at a parallel, and the best parallel that's a couple years ahead is financial services. And so I've been working with clients in that space for several years, and I think we're still in healthcare in kind of the innovation and experimentation kind of life cycle of this technology across, like on average. And it's going to take those kind of learnings, the trial and the error, right, to then inform strategy. And once you have strategy informed, you have a business case, you have a executive level kind of input and insight, right? Then you can start marching forward. And we're starting to see, and there's been announcements this week about some of that already happening. But I think we're going to get through this cycle pretty quickly. And so I think in next year at the conference, we'll see a lot more kind of here's what we did, and here's our results, and here's how we're going to take it to the next stage, as opposed to here's kind of like what we're planning to do and what we're in the works of. And that cycle just takes time, right? You have to do experimentation. You have to kind of learn. You have to get stakeholders engaged as in a new technology. In the case study I mentioned earlier, right, 70% of the work we did was change management, stakeholder engagement, education, right? The architecture, the design, right? The solving for all that was minor compared to that. So you got to get through that cycle, and then we'll start seeing, I think more consortia forming and being announced and having direction, and then some of the early adopters really pushing live. Because this year for financial services, it was all about a kind of a rush to get live with applications and networks. And I think next year we'll kind of set the trajectory for that. For 2020 is when we'll see, I think, those larger scale live in production for healthcare.
Awesome. Jim, where do you think you guys will be, or where do you think the revenue cycle management space will be next year?
Yeah, I still, I could probably draw back to a previous keynote on the Plato, where, we may have moved over to the left a little bit and have some formation. I just want to make sure that, we're set up as a conduit to provide access for our clients to enable some of these things. But I do, on a personal take, I am a believer of the personal health record, and that's been more of a theme this year. Solving that in our space is good. At personal experience, where I'm a type 1 diabetic, and my endocrinologist moves health systems, and he had to get a lawyer involved to get my medical records. So I really would love to own it myself. So I'm encouraged by some of the new entrants. I think it'll take a while, but it's a journey that's worth it.
Awesome. Well, for all the people who are out in the audience who work in a large company, who are building those initiatives, I think we have a great example on the stage of people who are moving the needle and doing meaningful work. And we're excited to be able to hopefully hear from you guys next year and get an update. We appreciate your time.
Great job, Philip. Thank you very much.